Hi, everybody. My name is Cailin O'Connell. I am the nurse practitioner in the Heterotaxy program at Children's. Do I have to do anything to make this live? I am also so grateful to be here. It's been really amazing to be amongst this audience and hearing everybody speak about a topic that is so near and dear to my heart. So I'm going to be using my time today to just briefly describe my role, because I know it is quite unique. And then we're going to highlight two initiatives that our program is particularly proud of, and that is prenatal heterotaxy consultations, as well as our postoperative airway clearance regimen that we have initiated for every cardiac patient that has open heart surgery, every heterotaxy patient that has cardiac surgery at Boston Children's. Okay, so just a little bit more about my role. For those of you that were at the conference, the virtual conference last September, you may remember my husband's amazing Photoshop skills on display, where I got to talk about all the different hats that I get to wear on a daily basis. But basically, I meet the patient wherever they are in the hospital or outside of the hospital. I meet patients virtually. I meet patients in the outpatient clinic, in the inpatient units, and also in the fetal care and surgical center. My main responsibility, or what I focus on the most with families and children, is education. Education about what is heterotaxy, how is their child impacted by heterotaxy, because we know that everybody can be quite different. I also work really hard to understand what care has been done for that child previously, because we want to make an effort to not duplicate efforts, because as you can imagine, we're seeing patients that come from really all over. After I meet with families, then I work with our wonderful heterotaxy program providers, some of whom are in the audience, to determine a care plan for those patients. And then I really work behind the scenes. And I think this is one of the things that lends to being, somebody who's worked at Boston Children's for a long time, have relationships really across the institution, and have built partnerships in anesthesia and the cath lab and the ICU, to try to embed some of the care that we need for our heterotaxy workup into care that the child's already receiving. So for example, obtaining a nasal brushing when the child is already under anesthesia for another study. So we really work hard to not ask for extra blood draws and extra discomfort when we're trying to obtain all this data that we need. I'm also the person that's responsible for follow-up. So after our patients and families have moved through their heterotaxy visits, circling back with families to make sure that they understand all the information that they received, make sure that their home teams receive that information, and just really serve as that touch point for families for really forever, for a lifelong connection, so that if any issues come up in the future, to know that they always have somebody that they can reach out to at our program to provide further guidance as they move forward. So now let's talk a little bit about prenatal heterotaxy care. And as we have heard so many times from the wonderful families that shared their stories with us, this is a stressful and overwhelming time. It was described this morning as a time of terror. We recognize that this is really an extraordinary undertaking for families in the prenatal period. And so shortly after I joined the program, we came together and recognized that there was an opportunity to really bolster the care that we were offering families in our fetal care and surgical center. And so this actually is an additional clinic visit that is offered to families, geared specifically to heterotaxy education. And we thought that this would be beneficial for two main reasons. Number one, it would allow the fetal cardiology staff to focus their time with families on the cardiac disease and any surgical management that was necessary, as well as for the families to have a dedicated opportunity to sit with a clinician, talk about heterotaxy, but also how to distill that information for their child, because as some of you guys alluded to, the first thing people do is run to Google after they hear this information. So to be able to sit down with someone and really kind of distill that information in terms of what matters for them and what it matters for their child has been really helpful. After I meet with families, I do document a postnatal care plan in the mother's chart. So that is placed there to help the downstream providers once the baby arrives, and highlighting some of the important care that is necessary in the few days after birth. And this really has allowed us as the heterotaxy program to be integrated into the child's care team from day one, which is just really super beneficial. Next, I'm going to share with you a couple slides that I review with families. So we actually, I pull up a PowerPoint presentation on Zoom and we go through things system by system. So this one, of course, is the immune system. So we talk all about the spleen. We talk about how do we work up the spleen, how do we understand whether the spleen is functional. As was so nicely highlighted yesterday, we go through the 3 pillars of infection prevention. So we talk about immunizations, antibiotic prophylaxis. We talk about fever plans. This next slide here has to do, of course, with the lungs and the airways. So we talk about PCD. We talk about the symptoms that can be observed in newborns and how to watch out for those. And then we review the different diagnostic studies that we offer at Children's to work up PCD. And lastly, here is my GI tract slide. So we talk about biliary atresia, we talk about malrotation, and of course we review the signs and symptoms of volvulus, which hopefully is rare, but certainly we have decided that that's important information that every family is aware of. So at this juncture, I've met with 17 families since we started doing this a little over 2 years ago, and the response has been very, very positive, both from families and clinicians, just to kind of have a standardized set of recommendations for once that baby arrives. And next, let's talk about our postoperative airway clearance regimen. And I couldn't be more grateful for how the stage was set for this yesterday, and how we are all well aware that children with heterotaxy do face higher rates of chronic respiratory symptoms and higher rates of respiratory complications postoperatively, and that is regardless of whether or not they have primary ciliary dyskinesia. This is likely related to a component of underlying ciliary dysfunction, which may not manifest as daily symptoms for a child, but certainly when they come into the hospital and they go on the bypass machine and have a breathing tube, certainly these manifestations of poor airway clearance can surface. And so we at the Heterotaxy program put our heads together and we said, okay, if the research is saying that these kids do struggle more when they are under stress, what can we be doing on the inpatient side to really help them out? And so we developed this airway clearance algorithm. So this is really for every patient with heterotaxy that comes into Children's and is having cardiac surgery, is offered this airway clearance algorithm. This was developed across the Heart Center, but really outside of the Heart Center as well, with colleagues from pulmonary, the intensive care, respiratory, physical therapy, nursing, et cetera. It really was a broad effort. And so I know you can't see all the details here, but basically there is a column for intubated patients, extubated patients, and then within those columns, suggestions for children who are progressing as expected from a respiratory standpoint versus those that are struggling. The hallmarks here would be administration of Zopanex or albuterol for bronchodilation, followed by a mucolytic like 3% saline. And this is done in combination with chest PT administered by nursing or physical therapy, and also garnering the support of our physical therapy colleagues and promoting early ambulation, et cetera, and the importance of that in airway clearance. So we are collecting data on this. We're actually in the very beginning stages of putting together an abstract to share our findings. So far, we've been doing this since January of 2025, and we've already enrolled 35 patients. So again, we're really hoping that we see a positive impact here. So again, this is just from January 2025. Phase 2 of this project is getting underway, and that will include embedding this algorithm into the electronic medical record so that it's really kind of easier to navigate for our frontline providers, as well as I'm currently working on developing a family education sheet. So just to educate families on why we feel that this is important so that they can be empowered to assist in this care and ask for this care when they're on the inpatient units.